record on this computer. All right. All right, well, good morning, everybody. It's so good to see you, and I love the camaraderie already of everybody connecting and thinking through how in our many past lives we were connected in one way or another. My name is Megan Thomas. I'm the interim president at Catalyst of San Diego and Imperial Counties, and really happy to have you all here today. My pronouns are she, her, hers, and like I think probably all of you, unless you're beaming in from Palm Springs or something, I'm coming to you from the traditional and unceded territory of the Kumeyaay people in this land we call San Diego today. I do want to welcome you and encourage us all to think of one another, not as experts and learners, but as colleagues in this fight for equity and safety, health, and prosperity in our communities. Catalyst is a community of funders. We have about 150 members, several of whom are here with us today. But our goal is really to be a place where people come together for solutions. We believe in collaboration strongly as the path forward and ground everything in equity and community leadership. We recognize that there are some power dynamics, some things that come into play when we talk about folks who have resources and folks who are putting work together on the ground and can use those resources to fuel that. And so as much as possible, we like to build relationships and recognize that everybody has a part to play. We're super pleased to have Nancy and Roberto, Doug and Nicole, Ellen, and her colleague, perhaps Dr. Miller, will be able to join us to talk about the efforts that they are leading or involved in on behalf of our communities. But we also want to encourage conversation. So to do that, I want to just do a quick, this is going to be a test of our discipline, right? So we'll do a quick around the horn of who we are, just maybe sort of, name pronouns, who you represent, and like, if you want to, one sentence, literally one sentence on your involvement in civic engagement and vaccine. And the foundation of this particular session is to build on the tremendous success, thanks to all of you, that we had with Census outreach recently, recognizing that building up a really connected, collaborative community outreach effort for Census is really just evidence of how powerful we can be when we have civic engagement infrastructure, conversations, connections, coordination, and the importance of being able to support that. And when we're talking about philanthropy, that means investing in civic engagement, community-based organizations who build relationships and connections to residents in our region throughout the year. So we don't get into this cycle of, once every 10 years for census, once every 2 to 4 years for elections. But really, when you think about relationships, you don't just think about your friend when you meet them, you think about them all the time. And so it's also important for us to be able to connect with and communicate with our communities on an ongoing basis. And that takes time and effort and funding. So we recognize that census outreach and the other work that's been done set us up for, though we wish we didn't have to be doing this vaccine outreach, a really successful effort in that, because we already know the people that are being reached out to. So I'm going to call like 3 names at a time, and we'll just try and get through this in about 5 minutes. And I'm going to skip the folks who are going to speak, just because they'll introduce themselves when they do that. And just we really want to thank Nancy for joining us this morning. She'll have to jump off at 10:30, so we're going to go to her first when we do this. Okay, so let's say Carlos, Michelle, and Joe.
Good morning, everyone. Carlos Medina, pronouns he, him, his, Learning Services Manager at Catalyst. And don't have much vaccine background, but my background in civic engagement has been mostly volunteering with a few local boards here in San Diego and nonprofit organizations. And I'll hand it over to Michelle.
Still looking for the unmute button. Michelle Jaramillo, Director of Education Initiatives at the San Diego Foundation, pronouns she, her. I'm sorry, I didn't follow the instructions for The
That's fine. All that, if you want to, one sentence on civic engagement or vaccine.
I will pass to my next colleague. I've got too much to say about both of those issues to keep it to one sentence.
Beautiful. Excellent modeling, Joe.
Thanks, Michelle. This is Joe Gavin. I'm the Chief Program and Community Engagement Officer for the San Diego Seniors Community Foundation. Right now, a focus of our organization is with senior centers and other nonprofits, and looking at some of the more challenging aspects of the vaccine to older adults, namely those who don't have access to the digital environment, those with transportation issues, those that are homebound, and looking, exploring ways to see how we can get that population access to the vaccine.
Wonderful. Thank you, Joe. Let's go to Reina, Sarah, and then Carla.
Hi, my name is Raina Canali. I'm from CRLA. My pronouns are she, her. I led the 2020 census project for CRLA statewide and our outreaches to farm workers and getting the vaccine.
Thank you.
Hi, I'm Sarah Lyman. I'm the Executive Director for Alliance Healthcare Foundation. And we've made some grant support in both census outreach as well as COVID-19 outreach, specifically for communities underserved communities and communities that have been hard to reach.
Hi, my name is Carla Lopez del Rio. I am with the Center for Social Innovation at UCR. My pronouns are she, ella, and I also hablo español. Before coming to the center, I worked for the U.S. Census Bureau. I did the outreach here in the Inland Empire, like that. And before that, I have about a decade of community development experience. So a lot of this stuff about civic engagement and helping the information and now the vaccines get to hard to reach places has been some of my passion in the past and my reality today. So glad to be here too.
Thank you so much, Carla. And I'll make note that Carla and her colleague, Karthik Ramakrishnan, who may join us, are leading an effort called Census Legacies throughout California and expanding nationally to do just what we're talking about here, expand on the census infrastructure to build stronger community connections for year-round efforts. Okay, Tara, Rosa, and Karen.
Hi, good morning, everyone. I'm Tara Westman. Sorry for not being on camera today. My pronouns are she and her, and I am part of our internal census work group that has focused on the census, and we are very much engaged in civic engagement all year round. So I really am very happy to participate in today's meeting. Thanks.
Good morning, Rosa Diaz from Imperial County, CEO and founder of the first LGBT center in this area. Good morning.
Good morning. Karen and Luis.
Yep. Hi, everybody. I'm Karen Winston with Alliance Healthcare Foundation, Communications Director, and I'm here to help the communication outreach efforts. So on behalf of your group and activities, as well as some of our grantees who are doing some specific work in their specific areas of population. So.
Good morning, Luis Montero Adams with the San Diego LGBT Community Center, pronouns he, him, his. I led our organization's efforts for the census as part of Count Me 2020 Coalition and currently have the honor of representing the center at the San Diego County COVID Equity Task Force.
Okay, with that, I know some of you have colleagues, but let me hand it over to Nancy with much appreciation to share with us about the San Diego Latino Health Council, our coalition, and the work that you're doing now. Thank you for being with us.
Yeah, so I can get us started and then I'll pass it over to Rebecca because I don't have a hard stop, sorry. So yeah, I'm Nancy Maldonado and I'm with Chico Federation, but also with the San Diego Latino Health Coalition. So I wanted to share a little bit about how this coalition even came about because I think that part is kind of important. When back in March, when the first stay-at-home order went into effect, we we knew just from the work that we do that this was going to be bad, or particularly for Latinos in San Diego County, but for a lot of groups, right, for everybody. But so as soon as April, probably the next month, we formed a group of organizations just to start the conversation about, gosh, what are we seeing and what can we do collectively right now in this moment, but also how can we start to think about what changes need to come from this. And so naturally what happened from that group is that we did form this coalition once we were able to secure some funding to do the work that we needed to. And I do think there's a story to be told in how that funding even came about. Chicano Federation was very active in kind of calling out some of the things that were not happening for our community and some of the assistance that wasn't happening and the outreach. Very early on, we saw that the education and the information wasn't in Spanish, along with a lot of other languages, but that was problematic for our Latino community here. And so we were really kind of adamant about staying on top of what we were seeing and what we were needing from the county. And so, when the RFPs came out from the county to do some of this work, we very quickly went into, we had already started meeting as a group. So we went in as a coalition of, at that point, it was about 10 different groups and applied for the funding together and came up with a strategy of how we were going to do this work. And the model that we decided to use was, each of these organizations was already doing outreach in their own way to the people that they served. And so we really wanted to use that and just be able to enhance what they were already doing. So rather than come in and say, everybody's going to do the same thing, we said, what can you do and how can we support what you're already doing? And, I think it's been really amazing to see some of these organizations, particularly some of these smaller organizations, really flourish within this coalition once they were given the resources and the support. That's been really cool to watch. So that's really how the San Diego Latino Health Coalition came to be, is that we said, what can we do collectively? And now we're there's about 20 different groups that are part of the coalition. And we meet weekly to talk about what we're doing. We have outreach strategies for, what we're focusing on. We have a PR company that we're working with. So it's, we say that we unfortunately had to build the plane as we were flying, right? Because nobody knew what they were doing and still doesn't know what they're doing. But within that, we've also been able to explore some research projects, because we wanted everything that we did to be based on data and research and to be really based on community voices and what the community was hearing, what they thought about the messaging, and how we could elevate the concerns that they had. So it's been really kind of a wild year in terms of how we got to this point. But I think that we're doing some really great work as a coalition. And actually, I just had a call right before this from a group in LA County who was saying to me, this is unique. How do you get so many groups to work together, right? And so I think what we're doing here is pretty special and pretty unique. And so at some point when when things ever slow down and if there's a world past COVID, I'd love to do kind of a recap of how this all happened and kind of use it as a case study. But that's how the group was formed. And so I'd love to pass it over to Roberto to talk about the specifics about the campaigns and the outreach and the focus groups and everything that goes into how the messaging is developed. And also, because I think it's really important to share lessons learned and mistakes that we've made along the way and kind of, in hindsight, what would we have done differently? I think that's a really important piece too. So I'll hand it over to Roberto.
Thanks, Nancy. So good morning, everyone. My name is Roberto Alcántar. I'm the Chief Strategy Officer here at Chicano Federation, and also working with the San Diego Latino Health Coalition. And, as Nancy mentioned, this just came out of the need to really advocate for our communities and be that voice to really bring attention to the issues that we were seeing in our community that were being ignored at the time. And so in conjunction with, what we were doing as the San Diego Latino Health Coalition, we were also, advocating directly with the county and the city of San Diego, because for us, the messaging is that going back to normal was not an option for our communities. We had to do better and really start the work to repair the damaged safety net that wasn't even there for our communities. Right. So looking at factors like the lack of access to housing that forced, multiple families to live under one roof, and increasing the infection rates that way, the lack of access to healthcare, the lack of access to economic opportunity, the low wages in our communities, all these factors that folks didn't just, that hurt our communities already, really just kind of put us at a huge disadvantage when COVID hit. And so what we did from the very beginning was actually talk to our community and find out what they needed. Because, one of the things that we were seeing is that there were all these mass distributions happening, throughout the county, and people were just getting boxes of food. But we knew that our community had more needs than that, right? And picking up a box of food that is primarily food that other folks don't want to eat and is donated is not necessarily what our communities need right now. And our communities deserve better than that. So we started talking to our communities, finding out what are the biggest needs right now, what do you need help with, and how can we help you out? And one of the things that came to the top was obviously cash assistance, to help families, bridge the storm, but also things like rent relief, which was really huge for us. And so we took that information and we're able to advocate directly with our council members, like Councilmember Chris Ward. Him and I have a pretty good relationship. We're former co-workers. And so we came to him and said, hey, we need to do something about this. And so he brought forward a rent relief program for the city of San Diego. And then we met with Supervisor Greg Cox's office and also, talked about the rent issue, and they brought forward, some rent relief too. And what was really great about this is that we were able to show the model that we were already doing with the county, which was the San Diego Latino Health Coalition, which funds the CBOs to go out and do the direct outreach. And we modeled the rent relief program after that too. So essentially we worked with the San Diego Housing Commission to develop a program where we had a couple CBOs get funding from the San Diego Housing Federation, not the San Diego Housing Commission, to then do that outreach, pay for staff time, help people through the application process, because folks, really didn't have, folks needed that assistance, needed that help on their own. And so that's how, we started really doing the advocacy work and really thinking about what are the ways that we can really help people better reach the services and meet the needs that they had. And so, part of that was also just understanding that we as nonprofits, we have the ability to advocate and we have the ability to go out there and leverage our relationships and our power from the folks that we represent to get stuff done. And, I've been very fortunate that, myself, I serve on the Southeastern College Governing Board. So I've been elected for 5 years now. And so I have really close relationships with, most elected officials here in San Diego County. So my role was like, I need to go out there and build these relationships, build these opportunities for our community. And we've been very successful. And through that work, we're able to also get $25 million for our providers. So a lot of our in-home childcare providers are providing that super essential service to our community to make sure that essential workers can continue to work. And some of these providers were saying, hey, we're going to have to shut down because we don't have enough funding right now. We don't have enough folks that we're serving. And so we worked with the county to get $25 million in stipends for providers. We also got $5 million from the county, $5 million from the city for additional childcare slots for essential workers. And through the coalition, we were able to tap into our supply network, as a large organization that has a childcare center and, alongside with the YMCA and other organizations to buy supplies, sanitation supplies directly from suppliers and get them into the hands of providers. We've also, done we do continuous research. So we partnered with Sandag to do a research project on finding out what are the biggest barriers to the Latino community and South Bay communities regarding, access to resources, but also the impact of COVID on these communities. And so with that data, we've been able to, as a coalition, work directly with the county, work directly with, leadership in different levels of government to really develop policies moving forward that are going to address these needs and are going to address these issues. Because we cannot move forward without actually having that research, but also, developing those good relationships with our leaders who are making these decisions, right? And making sure that we are at the table and helping dictate where these resources will go. And so that's something that we've been very intentional about. And even looking at, for example, when the vaccine rollout started to come out, we immediately organized all our folks and we wrote a letter to the county saying, while you're doing the considerations for where the vaccine will go, we need to make sure that we're targeting not only the essential workers, but essential workers in the most impacted zip codes. And so we outlined the zip codes that were the most impacted, and essentially just kind of went into the public meeting with the county and just called it out, right? And that's one of the things that we haven't been afraid to do, is just calling things out. And so the county has this, to be very frank with you, they have this love-hate relationship with us sometimes because, we call them out, but it's in good faith, right? And what we love is that they've been very responsive to us. Anytime we bring up an issue, they're like, you're right, let's fix it. How do we move forward? And so it's been really great. But, there's been situations where, we could have done a better job at really just developing some of the strategy in terms of, being able to bring everybody together, because it's tough. We have so many different organizations that have different interests, who have very different relationships with a lot of, our leaders. And so we get it. Some folks get really nervous about the advocacy work, about really pushing our leaders to do better, but that is our role. Right, that is what we're here for, and that is what the community expects from us moving forward. And so through the coalition, we've been very active in just advocating, beside our role, which is to get the information out to the community, really tapping into the promotora networks, really tapping into the fact that a lot of our organizations have been in the community for 50 years or more. They're in the neighborhoods, people know them, they trust them as trusted messengers. That is our primary role. But we're also leveraging all the knowledge that we're building, all the data that we're getting from the community to build that into a legislative package, which is ultimately what will come out of this work, is a substantial legislative package that we want to move forward to rebuild a safety net here in San Diego County that currently does not exist. And we were very frank with the situation. We basically said that, not only is it a systematic failure, but it's also stuff that's rooted, in racist policies that led to intentional underfunding of many of our communities, and we have to call that out. And so we did that, and that was part of the work that we've been doing with Supervisor Vargas and Fletcher, and bringing forward, calling racism a public health crisis. These are the kind of things that we need to do as organizations to move forward. And so now
I'm just going to ask you to maybe wrap up in 30 seconds.
Yep. Wrapping it up. So now we're moving into our phase in with the vaccine. And so now our role is to provide that education. We're not necessarily telling people go get the vaccine now, but rather we're just making sure that our community has all the information that they need to make an educated and reasonable decision for themselves, based on the information that's out there and not on rumors and misinformation. So that's where we're at, and that's what we do. And we're going to keep moving forward and bringing forward advocacy and policy with doing the direct outreach.
Beautiful. Thank you so much, Roberto. And what I heard throughout was the power of a coalition is not just that you can reach more people more successfully, but your voice can be more powerful when it comes to forming and influencing the policies that lead to us needing to do this outreach in the first place, right? Is like how our governments are considering and supporting the communities, not just for emergency response, but the fundamental needs in terms of wage and food security and healthy conditions for jobs and education.
Right.
Thanks so much. Just want to note that Rosario Ayanacone from Press Philanthropies joined us. Thank you so much for being here, Rosario. And I saw Karthik Ramakrishnan, who joined us as well. Welcome. Happy to have you here.
Thank you.
So with that, we're going to move to Doug and Nicole from Health Center Partners and hear a little bit from them about their coalition and outreach work.
Sure. Nicole, would you like to introduce yourself first, and then I can go into the slides?
Sure. I'm Nicole Howard. Pronouns are she and her. I'm with Health Center Partners. We're a membership association of health centers basically federally qualified health centers, Indian health centers, as well as Planned Parenthood. I've been with Health Center Partners family of companies for almost 14 years now. One of my roles within the family of companies is to support the CMOs of the member health centers that come together as a peer group. There's a lot of information. It's changing every day related to testing and vaccines, and it's just making sure that they have the latest information.
CMOs is Chief Medical Officer?
Officers, making sure that they have the latest information. Doug will probably cover some information with you in a slide deck, and then I'll jump in to add things along the way.
Great.
Good. Thanks, Nicole. Good morning, everyone. My name is Doug Flaker. I'm the Director of Resource Development for Health Center Partners. My pronouns are he, him, and his. Just a little bit about my background. I've been with Health Center Partners for nearly 2 years. I've worked in federally qualified health centers and community health centers for about a dozen years, primarily with urban Indian health organizations, working with the Native American communities, both here in San Diego and in Santa Barbara. I've also been active in the LGBTQ communities and HIV communities. I served for 8 years on the San Diego HIV Planning Commission, where I got a real exposure to the power of community coalitions and community engagement and civic engagement. So I bring that to my work. And Megan, I want to thank you for the traditional land acknowledgement. I'm also located here in traditional unceded territory of the Kumeyaay people, physically located at the foot of State Street, downtown San Diego. So working from home. I'm going to attempt to share my screen, and I hope the technology will work. And I just want to give you a quick overview of our organization, realizing that many of you may not be familiar with Health Center Partners, but you know our members, I'm sure. So just to take you, can you see my presentation clearly? Okay, great. So real quickly, Health Center Partners is a consortium. We were founded in 1977. Today, we're comprised of 17 individual organizations. 13 of our members are federally qualified health centers, 3 are tribal health programs, and 1 is the regional affiliate of Planned Parenthood. We're actually a family of companies. So Health Center Partners is kind of the parent of 3 other companies, Health Quality Partners, which Nicole runs, which is our kind of research and grant-funded endeavors. And then we have Integrated Health Partners, which is a clinically integrated network, and Connect, which is a group purchasing organization. And Connect works nationally all across the US. Our goal is to work collaboratively with our members to improve overall outcomes for the families that we serve. Our mission is to be a thought leader and innovator. So we are always trying to be at the front edge of the changes that our health centers are having to work with, and to have that broad vision and be that nexus of innovation and bringing collaboration. Here are the logos of our members, and I'm sure you'll recognize most, if not all of them. So Borrego Health out in the desert, Clinicus is out in Imperial County, Community Health Systems primarily in Riverside County, Indian Health Council, Imperial Beach Community Clinic, La Maestra, Neighborhood True Care, which used to be known as North County Health Project, the San Diego American Indian Health Center, Samahan Health Centers, Planned Parenthood, Father Joe's Villages, San Diego Family Care, San Isidro, Southern Indian Health Center, Vista Community Clinic, and the Sequan Band of Kumeyaay Indians. So those are the 17 organizations that are part of our consortium. So in 2019, we served nearly 1 million patients and nearly 4 million visits. The vast majority of our patients are categorized as low to moderate income. The vast majority are receiving Medi-Cal assistance. Many are also Medi-Cal, and Medicare. And 3/4 of our patients identify as an ethnic or racial minority. So just to give you a little context on how we've been working in this space since March, the world kind of changed, obviously, for all of us with the pandemic. And we had to demonstrate a lot of elasticity and developing new capacities to do things that weren't really in our strategic plan for this year, but it really required our members to pivot immediately and respond to the communities that they serve. And one of the ways that we did that was to make testing more readily available in the neighborhoods of our members. So I said we're 17 member organizations, and our members actually operate 160 practice locations. So we have 160 locations, primarily in San Diego, Riverside, and Imperial County, but 2 of our members have locations in Orange and San Bernardino. So we have 5-county reach, primarily in those 3 counties, but there was a need to provide testing. And I know that you'll all recall back in March, April, and May, as we saw the numbers spike, that testing was very difficult. There were a lot of challenges, logistical challenges, getting testing supplies, getting PPE, just kind of gearing up and standing up the necessary infrastructure to provide the testing. I'm giving you some data here for the last couple of months to show that over the fall and the summer, things had subsided and our health centers were running about 2,000 tests per week. And then all of a sudden we saw a bubble in the fall and then the strong spike in demand for testing. So to date, we've provided 120,000 community members with testing. In that testing, we've identified more than 15,000 cases of COVID-19 infection, and that's a cumulative positivity rate of over 12%. This graph just gives you some illustration. Although our cumulative positive rate is nearly 13% at the moment, you can see that the communities that we serve in our region have had some serious spikes in infection rates. And more recently around the holidays, we saw infection rates that were higher than 20%. We have been monitoring very carefully the activities in Imperial County among agricultural workers, where infection rates in the spring and early summer were very, very high. We saw infection rates there as high as 26 and 27%.
Can I just interject? I think,
please.
Sorry, I just wanted to interject. One of the roles that we play as a membership association of community health centers that I think is important to go along with the testing numbers that Doug showed is we really supported our health centers in first sourcing PPE, the personal protective equipment, because there were shortages. We're pretty much set up to do that since we, Health Center Partners has a subsidiary that's a national group purchasing organization. In addition to helping source it for our members, between grants that we, the family of companies, was able to write, donations that our emergency preparedness coordinator manager was able to secure from the county, as well as an in-kind donation from our for-profit group purchasing organization, we've been able to donate, and it's been a huge effort in terms of logistics and warehousing it, about $1 million worth of personal protective equipment to our member health centers to support them in seeing patients during the pandemic and providing all of this testing in the community.
Thank you, Nicole. Very important point. Just the logistics involved in getting all this going. This next slide just shows you something that didn't exist 12 months ago. So after the stay-at-home order was issued back in the March and April timeframe, we had to pivot to telehealth. And, telehealth was virtually non-existent in federally qualified health centers prior to the pandemic. Maybe 3% of our visits were specialty care visits using telehealth. And practically overnight, our members had to stand up the infrastructure, the technology in order to deliver care for telehealth. And you can see here in the early days of the pandemic, nearly 3/4 of all visits were being provided through some virtual means, either a telephone call or a televideo visit, some form of telemedicine. Now that's leveled off to about 50%. So about 50% of our visits continue to be virtual, while patients have gradually been able to return to direct care. So I know our topic today is to talk about vaccine engagement. I just wanted to mention that one of the other roles that we did play during the census was we were a partner in a foundation-funded effort where we partnered with other regional coalitions of health centers to provide resources, training, communication strategies, peer-to-peer learning opportunities, and technical assistance. So we have that experience that we're looking forward to leveraging and aligning with the effort of your group and finding a way to address what Roberta talked about earlier, which I thought was so important because the messaging is critical. We can provide technical information, and the trusted white coat for some is reliable and trusted information, but for many others, it's the peer information. It's the community health worker, the promotor, the other information that's provided in the trusted advisor. So I think we bring to this discussion the ability to have an infrastructure. We have identified 49 locations out of our 160 that are geared up, ready to go as soon as we get vaccine. And as soon as the tier structure drops down to the general population and we're ready to go, we've estimated that we have the ability to deliver 350,000 vaccines between now and the end of July through 49 locations in 5 counties. As soon as we get to that point where we have reliable supply and the tier structure goes down to where we can serve a larger population. So thank you for letting me just walk through those slides, and I know we'll have some more time at the end of the meeting to maybe discuss the implications of that.
I think the important point, and I haven't checked in with the health centers this week, so things may have changed. You know, they have been or have vaccinated their staff. I'm not sure how much vaccine has come in for their patient population that would meet the criteria, like let's say 65 and older. I have not checked in this week. You know, they're ready and able. We've also provided our health centers with low-grade temperature freezers. You need special freezers for the vaccine, as well as medical grade refrigeration units to prepare them to be able to deliver the vaccine.
That's wonderful. Thank you. So I think we're seeing some themes here in the notion that being connected allows more rapid response, widespread impact. Roberto spoke about advocacy at the sort of county and even state level for the how or the policies behind rollout. And Doug and Nicole are talking about this existing network being leveraged for the logistics, really being able to push out information, product and procedures quickly through trusted messengers and skilled networks. So thanks so much for that. We have the pleasure of Ellen Nash speaking with us about the Southeast San Diego Rapid Response Network. And I think we'll see this really interesting progression of the different ways that coalitions come together. I know that this Rapid Response Network has faith communities, has school communities, has just residents who are trusted in their neighborhoods and know what the needs are and the way to get the message out. So Ellen, I'm going to turn it over to you to speak a little bit about the work of BayPak and the Rapid Response Network, and then we'll have probably 10 minutes left just to get into discussion. Thanks so much. Can't hear you.
Yeah, there you are. Thanks for having me here today. I've just learned so much listening to all of you all. It's amazing. A lot of, in fact, some of the things that Nancy said resonated with me because basically we started, it's very, 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 very grassroots. So driving, I live in Southeast San Diego, so I was just driving down Imperial Avenue in March, and I saw all these corners of folks distributing food, and what I thought COVID was going to be a 2-week, maybe up to a 4-week sort of event, then went into something very, of course, long-term, but we initially reacted to the fact that there were just food distribution on all these corners, people just giving out food that, in the back of their cars, and like, what is this about? So I personally, I'm born and raised here in Southeast San Diego, so I know everyone, and I'm the chair of BayPak. So I just got on the phone one Sunday afternoon and started calling people and saying, what's going on? We need to put together some sort of a collaboration or partnership around food distribution, which we thought was just going to be very temporary. But we could at least make it much more professional, much more collaborative. We didn't know anything about a food bank. I'm just being real with you all. We didn't know anything about feeding America. We knew nothing. We just knew that we needed to come together. So I put together a group of actually started out with like 10 partners, from pastors that I know in the city to Reginald Jones. I called him from the Jacobs and I said, Reginald, we have people around here, you know, just kind of distributing food out of the back of their cars. We got to do something much more professional and much more intentional and much more collaborative. And he said, yes, I'll get right on it. But to make a long story short, we just started based on the fact that I just drove around on Imperial Avenue, seeing people, giving people food away out of the back of their cars. And I said, oh no, this can't happen like this. So we have to put it in a much more professional way, much more humane, so it makes sense. So as a result of that, from March until now, we have been meeting weekly. Similar story to Nancy's story. We have been meeting weekly. We've been following, again, in our mind, we thought this was temporary, it was going to be over, and we'd all go back to our regular routines. So when it started progressing, it went from food distribution, then to PPE, then to distance learning, then to business owners, you know. So we were just following, the issues. I didn't know what we were doing, following the issues, but because we have relationships, BayPak has developed relationships throughout the community, school district, County of San Diego. Nathan Fletcher stepped right in when we made the phone call. Hey, we need PPE. You know, he awarded us grants and others. Megan helped us out. I called her. She started coming to our meetings every Thursday from March. We have been meeting and basically following the needle. Nothing as sophisticated as you all have described. I wish we did have those kinds of resources and support. This is all 100% pretty much volunteer. A lot of the BayPak members that we use to, like, for instance, distributing PPE, they are retirees. We received a contract. We put together a committee, and these retirees went to work. They're very computer literate, so they knew how to deal with Amazon and some of the others. And then what we did was we collaborated with food distribution. Food distribution is our anchor. That's where we get our messaging from. We translated Census 22 messaging into COVID messaging, but our anchor has always been food distribution. That's where we focus on distribution of Census 2020 materials. That's where we focused on testing, when we had to get folks tested. Our emphasis, of course, has been the Black community. So that's where our faith-based partners come in. We have about 10 different pastors that we worked with them to get the census messaging out, the COVID testing messaging out. We're connected with Dr. Rodney Hood through his Multicultural Foundation. So again, we are not as sophisticated as you all, but we know people. And because we know people and they respect us, the advocacy work for us is, we need you to come on board and help us help our people. Help us help residents in Southeastern San Diego. And from that, we have the school district, Dr. Sharon Whitehurst Payne, on distance learning. And we were really advocating for the fact that we have parents through some of our churches and through some of our friends whose kids were not up to speed with their devices. So we were advocating with Dr. Whitehurst Payne that, you know, you got to come up to speed and supporting our families. So our advocacy work, really, we just followed COVID. And as COVID got worse, we had to ramp up and we followed that particular work. So that's where we are. We were meeting monthly up until probably before the holidays. And then we went to 2 weeks, every 2 weeks. And now we're at the point of the vaccine, and BayPak held a forum during our general membership meeting on the third Saturday of last month. So last month? Yeah, last month. This month, yes, January, on the vaccine in the Black community. We had all the doctors there, Dr. Hood, Dr. Afalo, all the Black medical doctors, very few, but we had them there. And Dr. Akila Weber was there, and we promoted it with a flyer with them actually showing, we said, get your arm, we need your arm, so that was the way the messaging, you have to put it around where people can relate. And the messaging was around, we need your arm. It was around the arm. We had all the doctors putting that shot in their arm, and we gave them the floor for about an hour and a half. And people, we must have had probably, it was on social media. So it was Facebook Live and YouTube. And I was just looking at it today. We're up to about 1,000 viewers. So it's still transferring around 1,000 viewers. Even my relatives on the East Coast were on the call, and everyone was able to answer questions. We went a half an hour over with those doctors, convincing folks, compelling people, not convincing, compelling them with the right information, as someone said, on what your fears are, from allergies to, my mom was trying to convince us that she wanted to wait and see. And they talked about the implications of the wait and see, which for her, what resonated to her, got her there this morning was, Mom, we want to come see you. That's what for, I can't see you, Mom. I want to come see you. And it's been since March. My mom has adhered to staying in the house. If you look at her, I have a picture of her on Facebook getting that shot this morning. And that's another way. A trusted messenger is, you got to show people and convince people that it really does work. That's how you convince people. And I've had text messages telling me now, Miss Ellen, I'm getting ready to take my mom. We're calling to make our appointments. So we're much more hands-on, but that's the trusted messenger from the Census is what I've just been advocating for, that we really need to hone in on, and convincing folks, particularly African Americans, to get that shot in the arm. That's the way we've been able to do it since then. And from that meeting we had, again, we had over 1,000 viewers. We have people that are calling the doctors, asking for how do they get their shots, and then we're all keeping each other accountable. We did Channel 7 covered it. They've been promoting it on Channel 7 around the forum. They featured the doctors. They featured me several times as well. So it's working. But it is that I respect Census 2020 trusted messenger approach because it is very, very effective, as Megan, as you know, particularly for the Black community. You have to make it real plain and simple. When I said, Mom, I want to come see you, I haven't seen you since March. I need you to cook some of that good old, the chicken that you do, and the greens and cornbread. She said, okay, baby, I'm going to get my shot today.
If it means we can have dinner.
That's right.
That's right. Wonderful.
Yeah. So
yes. Thank you. Thank you, Ellen. Thank you. And I think let's recognize that is a very sophisticated approach.
It is.
Absolutely, like maybe less technical, but you're talking about bringing in institutions like the Jacob Center, bringing all the pastors along, making sure that people are tailoring their message to the people they're talking to. I think everybody here could learn something from that as well. It's not about, we need to find out what the approach is, but we need to find out who the people are and then let them do what they know. And that's wonderful.
Right.
So we had, we tried to keep this down to an hour so everybody could benefit and feel like they could participate. If we have a couple of questions, happy to do that. And then I'll wrap up, but know that this is the beginning of a continuing conversation. So if anybody wanted to ask a question of Ellen or Doug or Nicole, or just share any insights that you're gaining from this conversation, happy to hear from you.
I would like to say, with regard to the vaccine, the immediate response on TV on Channel 7 that came after featuring us was there has been a low response rate in the Black community. And for me, I was very confused about that because a segment before, the vaccine had just landed in San Diego. So how did you know it was a low rate if the vaccine just landed here? You know what I'm saying? So I'm still confused about that, but I can respect the data and the research that who was it? The Chicano Federation was talking about. You know what I mean? That's the piece that now with the vaccine, how do we figure out, particularly if that is the case, there's a low rate in the African American community, how do we figure out why that is and how are we going to make people accountable? You know what I mean? You got to measure it. How can we improve? If there's already a low rate, how can we make it a better rate? You know, so that's kind of where we are right now. So it's not just getting the shot in the arm, but you know, kind of like responding to the fact that there is a low rate of response to the vaccine in the Black community. How do we improve those outcomes?
Yeah, that info is very important.
Yeah. And that's what I need help with. I would love for you all hear some of the experts that talk about data and research, accountability. How do you help a grassroots organization like BayPak hold people accountable to ensure that does not remain the outcome, low rate in the African American community? How do we improve those outcomes?
Michelle, did you have something?
I don't, I'm not sure exactly what my question is. So I'll share something that's, one thing that's been on my mind, our minds, is the connection between, you know, the rates of receiving and applying the vaccine and digital literacy. Because what we know so far is that most of the ways we find information about the vaccine and actually sign up for a slot to get our appointment for the vaccine is online, and that's predominant. And so I'm just curious about the groups that have spoken about your experience and your thoughts around that that challenge with so many of our community members, again, the digital divide being a continuous issue. And even when there is, you know, physical connectivity, digital literacy being an impediment for folks to actually get into in queue for their vaccine. And I'm just curious on thoughts and on solutions for that issue.
Yeah. And you're right, it carries over. This was an issue with the first ever online census. It has been a challenge for education. So maybe we can have, I know we're coming up on time, people may need to leave. I don't know if anyone wants to give a very brief answer to that. I'd also like to offer a space, Rosa, if you want to, no pressure, but if you want to comment anything about what's happening in Imperial County, that's a critically important arena as well. And I know the health center partners are working there.
Sure, thank you very much. I think that right now, because of some funding, we were able to hire some people to help us with promoting messaging for the vaccines and safety precautions. And that is something that has helped us to be able to get some young whippersnappers to do the outreach and the social media, which I still have a hard time with Instagram and some of the other apps, but it really is in the Latino community, the same thing. Sometimes it's like two extremes. One extreme is, heck no, I'm not getting the vaccine. We still don't know what it's going to do to our bodies, et cetera. So we have that population that we're trying to educate. And then we have the other extreme, and some of them within the LGBTQ community, they will not leave their house out of fear. And the only thing that's going to save them is a vaccine. And unfortunately, there are no vaccines right now. You know, there's a waiting list. There's a line of people that are trying to get an appointment. And those that did get the vaccine, the first vaccine, they have no idea when they're going to get the second vaccine. So the messaging has to be in a way that doesn't bring any confusion. We can't promise vaccines if we don't know that they're going to come in, and we have no idea. We're in touch with the public health department. And then the other thing is, when vaccines do come in, why are people being vaccinated outside of the tiers, which is what was implemented? So that's a huge story here in Imperial County. I don't know if you've been reading our local news, but in the first batch of vaccines, people out of line, not in the right tiers, got vaccinated, and it's some politicians, councilmen, and women, and so there's a lot of right now. What the county is trying to do is ease all the confusion and the hate messaging. So it's pretty crazy, and we feel that we are right now just trying to work as a collaborative to be able to put people at ease, but at the same time continue working with our local government to get those vaccines so that people can get vaccinated. So it's ongoing, and we're doing our best, but it's a privilege for me to be able to be in these meetings and find out what's up to date and what's happening in other counties, and then take it back to our public health department.
Wonderful. Thank you so much, Afsha. You know, I think you make a good point, is that we all have the privilege of serving. So we're going to wrap up now. And, you know, I think, you know, part of the goal here was to share information about the vaccine. Part of the goal was also to highlight the critical importance of staying connected, of having coalitions in our communities who understand the challenges and who is stepping up to serve and can help coordinate and make that as effective as possible, and advocate for those who are so often overlooked, right? Our communities of color, folks of lower income, folks on the front lines. We know that the messaging, the history of, for example, the relationship of Black folks and the medical profession. Like these are challenges that are coming not just because of the messaging today, but of what has transpired in our country, you know, for many, many years. And we have the opportunity now that everything is sort of blown up to rebuild in a different way. But that will only happen if our communities' voices are uplifted and the organizations that are there to support and build power can do that. So I thank you all for being with us today. Thank you all for everything that you do. Please stay connected. We'll continue to build coalitions and cooperation and advocate for the well-being of our people. I hope you find rest, health, and vaccines in the very near future.
Okay. Take care.
Yeah.
Thank you, Megan.
Bye-bye.
Thank you for this amazing meeting. Bye.
Thank you, Carla.